About acne information, getting the most from your doctor. A physician or dermatologist can be essential in helping someone fight acne. If you go to see a skin specialist, here are some tips to communicating with that individual to maximize the effectiveness of the appointment. There's nothing trivial about having acne problems. If you are one of the millions that suffer from acne outbreaks, you know that it can be uncomfortable and even sometimes devastating to someone who is seriously afflicted. As you consider treatment options, you may want the professional help of a physician or dermatologist. These highly trained specialists can be invaluable in helping you achieve clear skin again. While they are not magicians who can make your acne disappear overnight, they can be essential in diagnosing and treating you so that you don't have to suffer any longer than necessary. It is important to remember a few things when visiting a skin care specialist. Because there are so many people in the world that suffer from acne outbreaks, dermatologists are often very busy with lots of clients. Don't let this vex you. A doctor is concerned about your condition and wants to help you. Here are some things that you can do to maximize your visit when you see them. Having effective doctor visits will help you overcome your acne sooner and also help you save money and time. First, don't be afraid to ask questions about your condition. Remember, we are all different, so a treatment that is highly effective with one person is not necessarily what is going to work for you. Knowledge about the particulars of your condition will help you better understand the condition you are trying to overcome. You may even want to write down any specific questions you may have to make sure you cover all the topics you want to know about. The most important aspect of having an effective doctor visit is good communication. By keeping some facts or aspects about your condition from the dermatologist, you are only hurting yourself by giving them an incomplete knowledge of the facts. The doctor can only base his diagnosis on what you have told him, so try to be thorough with the details about your acne. Tell them how long your acne has been affecting you, what other treatments you've attempted to do before, what worsens your condition, and any other factors that you think may apply. Tell them how your acne is affecting you emotionally and socially, as mental health is synonymous with your physical health. Once your doctor and you have discussed your condition, make sure that you fully understand what they will be doing in regards to your treatment. Be sure to understand the correct way to apply the treatment, how long the treatment will last, and how long it will be before you begin to see results. Also, be sure and find out if there are any side effects that go along with the use of the treatment. This will help you be better prepared for any occurrences or problems that may arise. Schedule a follow-up appointment with the doctor and discuss what the status of your condition should be when you return. If you are knowledgeable about the treatment and looking for the desired results, you will know sooner whether your current method is working or not. Remember that there are many treatments available that work better or worse for different people. Don't be discouraged if the first method you try does not attain the desired results. Be patient and work with your doctor, and you will soon be able to find the most effective treatment that is right for you. Tells you what acne is and is proper medical cure. Acne is a chronic disorder of the hair follicles and sebaceous glands. Some of the characteristics of acne include blackheads, pimples, cysts, infected abscesses, and rarely scarring. Acne usually occurs during adolescence in both men and women. To be more specific, acne starts during puberty and tends to get worse for people with oily skin. Acne badly affects teenage boys. Only mild to moderate forms of acne occur in middle-aged women. Acne can be seen most commonly on the face. The other places where it can occur include the neck, chest, back, shoulders, scalp, and upper arms and legs. Most forms of acne are the result of heredity and hormonal problems and has nothing to do with a harmful diet or poor hygiene. Types of acne. Acne starts in a similar way for all but can take different forms and can react in a unique way according to the body conditions of the individual. A basic lesion called the comedo is the beginning of acne. The comedo is an enlarged hair follicle plugged with oil and bacteria residing under the surface of your skin, that waits for the right conditions to grow into an inflamed lesion. Whenever the skin produces more oil, the bacteria grows within the swollen follicle. The surrounding skin becomes increasingly inflamed as your white blood cells fight against the intruders. Two main types of acne include non-inflammatory acne and inflammatory acne. Non-inflammatory acne. Closed comedo. If the plugged follicle stays below the surface of the skin, the lesion is called a closed comedo. This usually appears on the skin as small, whitish bumps. This condition is otherwise called as whitehead. Open comedo. If the plug enlarges and pushes through the surface of the skin, the lesion is called an open comedo. The dark appearance of the plug is not due to dirt, but due to the buildup of melanin, the pigmentation element of the skin. This condition is otherwise called as blackhead. Inflammatory acne. Papule. This appears on the skin as a small, firm pink bump. The papules are tender in nature and are often considered an intermediary step between non-inflammatory and clearly inflammatory lesions. Pustule. These are small round lesions that are inflamed and contain visible pus, which appear red at the base with a yellowish or whitish center. Pustules do not contain a large amount of bacteria. The inflammation is caused by chemical irritation from sebum components such as fatty-free acids. Cyst. These are large pus-filled lesions that are usually present deep within the skin. The cysts are very painful lesions, as they are inflamed. Cysts form as a result of the contents of a comedo spilling over the surrounding skin and due to the response of the local immune system in producing pus. The cysts often leave deep scars. Acne conglobata. This is a rare but serious form of inflammatory acne that develops primarily on the back, buttocks, and chest. In addition to the presence of pustules and cysts, there may be severe bacterial infection. Symptoms. The common symptoms of acne include persistent, recurrent red spots or swellings on the skin known as pimples. The pimples become inflamed and get filled with pus. The pimples usually occur on the face, chest, shoulders, neck, or upper portion of the back. Some of the other symptoms include dark spots with open pores at the center, which are known as blackheads, bulged spots under the skin without openings, which are known as whiteheads, and red swellings or lumps filled with pus, which are known as pustules. The pustules can develop from blackheads or whiteheads. Inflamed fluid-filled lumps under the skin known as cysts are also a symptom of acne. These cysts can become as large as 1 inch across. About acne, what can you do to cure or alleviate acne? The processes going on in the skin of a person suffering from acne are explained here. You also find a survey of the factors causing acne and measures you can apply yourself to prevent, cure or alleviate acne. Acne gives the combination of symptoms like greasy skin, whiteheads, blackheads, pimples, inflammation and scar formation. Acne mostly affects young people in the age 14 to 25, but also sometimes older persons, like women in their menopause. Most teenagers experience outbursts of acne, some only little, but for others acne may develop into a serious skin ailment with great cosmetic impact. Number 1. The skin anatomy. To understand the acne process, some knowledge about skin anatomy and physiology is essential. The skin has their layers. The outer layer, called epidermis, consists of epithelial cells. Under this lies the dermis, consisting of connective tissue. At the bottom there is a layer called the hypodermis, consisting mostly of fat cells. The skin has narrow pores extending from the surface down to the top of the subdermis, called hair follicles. A hair extend from a growth zone in the bottom of each hair follicle and out at the skin surface. Around the hair in the dermis, there are small glands called sebaceous glands. These glands produce a fatty substance, sebum, which empty through the follicle opening and lubricates the hair and the skin. Number 2. The acne process. Acne starts by the glands in the hair follicles increasing their sebum production. This will in the beginning only cause greasy skin. Eventually the sebum in the entrance of the follicles mixes with dead epithelial cells. This mix reacts chemically to forms hard props, comedones, that close the pore entrances. According to the color of the comedones, they are called blackheads or whiteheads. Then the closed hair follicle gets filled with sebum and swell. The swollen follicle then gets infected by bacteria. The bacteria and the accumulated sebum cause the follicle and the surrounding skin to get inflamed, forming a pimple. At last the inflamed follicle bursts and empties its content. Eventually the affected area heals. Sometimes the inflammation reaches deep into the skin surrounding the follicle and destroys skin tissue. This will cause more or less distinct scars that may reside permanently. Typically an affected person will have follicles in all these stages of the process at any given time. Number 3. The causes of acne. The increased hormone production in the puberty stimulates to increased sebum production. The male hormone, testosterone, seem to contribute most. Also, girls begin to produce more testosterone in the puberty. Also, in other periods, altered hormone production may give acne, for example by women in the menopause. Since not all teens get acne in any degree, the increased hormone level cannot be the whole cause of the increased sebum production. The follicles of affected persons must for some reason react stronger upon the higher hormone level. Dietary factors, like eating too much fat, too much sugar, or the wrong kind of fat may aggravate acne by some individuals. Lack of vitamins, minerals and essential fatty acids may also contribute to development of acne. Poor digestion, lazy colon and constipation aggravate acne in some individuals, probably due to productions of toxins in the intestines. Lazy colon may be caused by dietary faults, like lack of fiber. Very frequent washing and use of strong soaps aggravate acne, and does not alleviate the condition as many think. Rubbing, scrubbing or squeezing the skin may also aggravate acne. Here are some other factors that may contribute in causing acne or aggravating the condition. Stress, some contraceptive agents, environmental or domestic pollution. Humid environments. Some antidepressants. Testosterone and anabolic steroids used for treatment or by bodybuilding. Use of some types of greasy cosmetic products. Some antiperspirant products. Exposing the skin for chlorine or other halogens, or medicines containing halogens. Women may get aggravated acne 2 to 7 days before menstruation. What can you do yourself to avoid or to treat acne? Sometimes acne is so severe that special medical treatment is required, and sometimes the causes of acne necessitate medical treatment. But you can do much yourself also. Here are listed things you can do yourself to prevent or treat acne. 1. Some advices about diet that may help prevent and cure acne. Do not consume a great amount of fat. The fat you add to the food should be natural oils. Olive oil is ideal, but use other types of oils too, like walnut oil, sunflower oil and soy oil. However, do not use only soy oil as many tend to do. Using only soy oil will give you too much of some fatty acids and too less of others. Eat much fish, seafood and not so much meat. Eat food with a high fiber content to regulate the digestion, like vegetables, whole cereals, full corn bread and fruit. 2. Here are some things you should avoid. Do not use greasy or heavy cosmetics that clog your skin and are difficult to wash away. Do not use strong irritating antiperspirants. Do not wash with strong soap or cleaners that dry up your skin and take away all the natural oily protection in your skin. If you perform bodybuilding, do not use anabolic steroids or other hormonal supplements. Use clothes that allow air to reach your body surface to avoid collection of humidity and overheating of your skin. 3. Use of rinsing milk or solutions. You can rinse your skin with mild products especially made to dissolve the plugs in your pores, and to make the environment in your skin unfriendly to bacteria causing infection. Some of these products are just products to wash your skin with 1 or more times a day, others should be on during night and flushed away in the morning. Salicylic acid is a mild ingredient often used in these products to dissolve the comedones. The products usually also contain ingredients that work antibacterial and stimulate the skin's own cleaning activities, like tea tree oil or Echinacea extract. 4. Use of gels and creams to treat acne and protect your skin. After the rinsing, you should apply some treatment gel, cream or lotion onto your skin to achieve these effects. To make your skin soft and elastic. To protect your skin against the environment. To act further to dissolve the clogging of your pores. To soothe and alleviate inflammation. To kill the bacteria causing infection or make an environment hostile for the bacteria. To stimulate the skin to clean itself. To stimulate the skin to heal. To be used as an isolating layer between the skin itself and cosmetics. In order to protect, make the skin soft and further dissolve the comedones, many products contain natural plant oils that are easily absorbed into the epidermis, like tea tree oil, rose hip oil, lavender oil and olive oil. Ingredients used in products to reduce inflammation and to stimulate healing may be aloe vera extract, viola tricolor extract, rose hip oil, vitamin E and vitamin A. Tea tree oil and grapefruit seed extract are natural antibacterial agents used in many of these products. In other products, artificial compounds like benzoyl peroxide are used. 5. Oral supplements to fight the acne process and nourish the skin. Supplements taken by mouth to nourish your skin may be useful. The purpose of these supplements is more or less the same as that of nourishing creams. To make the sebum more fluid so it drains more easily. To stimulate the substance exchange and cleaning processes in your skin, to stimulate your skin to heal, to give your skin building nutrients necessary to heal. Ingredients often used in these supplements to stimulate the cleaning and healing processes in the skin are vitamins A, C, B1, B2, B3, B6, C, D, E, folic acid, beta-carotene, bioflavonoids, magnesium, copper, zinc, selenium, antioxidants from green tea, metylsulfonyl-methane. Nutrient found in these products used as material to rebuild damaged skin and to give a sebum with better consistency are evening primrose oil, olive oil, flax seed oil, borage oil, soy oil, wheat germ oil and lecithin. Gum guggle extract used in oral products has an antibiotic effect, and helps against spreading of the acne infection and thus helps against scar formation. Acne is often thought of as a teenage dilemma, and while it is true that acne appears most often during the teenage years, it is arguably just as true that there are a growing number of individuals that suffer from adult acne. Adults in their 20s, all the way up to their 50s can still experience acne flare-ups. And adult acne can have just as many negative effects on a person as teenage acne. Possibly even more so, as the stress of career and family adds to the strain of living with an unsightly skin problem. Mental stress can be one of the major causes of acne in adults. It is not a surprise in the slightest that women are often more likely to suffer from adult acne than men, as it has been shown that women have much more stress in their day-to-day lifestyle, not to mention that they are prone to hormonal imbalances, especially during times such as their menstrual cycle and pregnancy. Just as in teens, hormones play an important factor in the onset and exacerbation of adult acne. The environmental factors that surround a person, paired with the individual's lifestyle, can also play a huge role in the appearance of adult acne. An improper diet or behaviors such as smoking and drinking affect the skin's condition and resistance to acne, as well as other diseases. Prevention is the only obvious way to go when dealing with adult acne. A proper diet, paired with plenty of water and rest, is a good start. Trying to relieve stress and maintaining proper skin care and hygiene can also help to prevent acne from occurring. But what about the pimples that you may already have? There are many treatments available for people who have adult acne. Anti-acne medications, certain skin care products, and even laser surgery are just a few of the many treatments available for acne on the market today. Visiting a qualified doctor or dermatologist is the only way to determine how severe your acne really is and to find the proper treatment available for you.